Well, meantime, as cases continue to surge, conversations about a third booster shot continue. And it looks like it may be right around the corner. Sources tell NBC News that the Biden administration is backing the plan to vaccinate all Americans with the booster, not just the immunocompromised, which was authorized last week here in the U.S.
Senior health correspondent Monica Robbins is with us now. Monica, good afternoon to you. So a lot of people are talking about this third shot, or we probably should refer to it as a booster, because in the case of J&J, there was a one-shot deal. Especially, they're talking about it now because we're seeing more and more of these so-called breakthrough cases. That's where someone's fully vaccinated from COVID, yet they still contract the coronavirus.
Right.
What do we know about this?
Well, it's very possible those third shots are going to be in arms as early as next month. The official announcement expected this week, and as long as the FDA signs off on third dose boosters, the rollout will be similar to how they first came out, with nursing homes, healthcare workers, emergency workers getting them first. Now, the general population would qualify 8 months after their second dose of Moderna or Pfizer. This does not apply to the J&J shot. Data is still being gathered on that one. The change in thinking is because of data being gathered around the world.
2 weeks ago, Israel they had some data suggesting that the number of breakthrough infections was much higher than what they expected, and it seemed to be growing higher. They started getting nervous, so they vaccinated now 1 million people that are over 50 in their country, and they're watching this very closely. I think some of the early data suggests that it might be effective.
And just yesterday, Pfizer submitted data to the FDA supporting the use of a booster shot. Meanwhile, we're not the only ones considering this, despite the fact that the World Health Organization called for a moratorium on boosters until the end of September because they want available doses to go to countries that are behind in vaccinations. Israel already giving third shots to those 50 and up. France and Germany will start giving them to vulnerable populations next month. And the UK also has a plan, but is holding off for now. But they did just today authorize the Moderna vaccine for those 12 to 17.
Wow, so there's
that's huge.
2 available. That's brand new.
In the UK, yes. Not here yet. Not here yet.
Okay.
Hopefully
so
here soon.
Still only Pfizer.
I got excited for a second.
12 and up.
Correct.
Okay.
Yes.
You know, I kind of harken back to the wash your hands, wash your hands, wash your hands days. And as we're laying out the steps and everybody, you know, as we're learning more about everything, you said we could be looking at COVID booster shots, much like the flu vaccine that we get, where they do a little tinkering and a little tailoring every year to try and nail it down, but you get it every year. Is that kind of what it's looking like for COVID vaccines?
Honestly, Betsy, it depends who you ask these days. So some hope this third dose will be enough to keep us protected and we won't need another. Others think as the virus continues to change, boosters will be likely. We do know that Novavax is working on a flu shot COVID booster combination shot. So I think we're just going to have to wait and see. A lot of this just depends on the virus.
Yeah.
What's the virus going to do? That'll tell us what's next.
Now, I know that this information is constantly changing, but didn't I hear Dr. Fauci say pretty emphatically, with a lot of confidence, that we're not going to need the booster shots yet? Hold on.
Yeah, that was yesterday. No, I mean, come on. Since the very beginning of this pandemic, I told each and every one of you that I may tell you something today and it may change tomorrow. The information is changing almost daily. We are learning new things from elsewhere around the world, too. And Dr. Fauci said we're also watching daily data closely and we're prepared to move quickly if they saw things change. And that's apparently what happened.
Yeah.
They've been watching to see what's happening in Israel, and likely what they're seeing, what hasn't been out yet, is that hospitalizations among breakthrough infections are beginning to rise.
That's
and
worrisome.
That's what we're really concerned about. Yeah.
All right. We're keeping a close eye on what Israel's doing because they were so far ahead of the curve on the vaccinations. Monica, great information.
Sure. Thank you.
See you tomorrow.
See ya.